So that is all I have for you today.
Thank you.
And thank you.
Great. Thank you so much for all that information that you shared with us today. Okay, so I guess everyone knows how to get in contact with you, so that's great. And now we're going to begin the Q&A session of our presentation. For audience members who wish to ask a question, you can go ahead and raise your hand in Zoom, and we will post the process to do so in the chat. There you go. So just real quickly, you mentioned something that I've heard of prebiotics before. I've heard of probiotics. I haven't heard anyone use the term postbiotics.
Hmm.
Can you explain exactly what they are and why they are important?
Right. So that's what when I was talking about, it's basically whatever you feed those bacteria in the gut, they produce things. They're called metabolites. I try not to use that word because it's call it products, whatever you want to call it, but metabolites. They produce things, and those things affect your body. And so when you're talking about kidney disease, there's some that are very beneficial. If you're eating fiber, then you feed bacteria that are going to produce things like short chain fatty acids. But if you're eating animal protein, you're feeding bacteria that are going to produce things, the postbiotic, the metabolite, that are kidney toxins. We know this. So things, the TMAO, the p-cressyl sulfate, and the indoxyl sulfate, you don't want to have kidney toxins because then your kidneys have to do something with that, and they're making them work harder. So that's why I brought that up.
Okay, great. Thank you. And you mentioned salts. Obviously, we should limit salts, and even below what the daily recommended amount is, according to what you were saying in your talk. In this health community, there's an idea of like different salts, such as there's sea salt, there's pink,
Yeah.
there's Himalayan pink salt. There's all
Right.
if you come up with the name, there's a salt that
Right.
that. Is there any difference from your perspective with regard to salt? Or some salts better than others, or we should just minimize all salts? And when I say salt, I'm some variation of sodium, right?
Right. So, I mean, some salts have more minerals, right? And well, and remind me, I'm gonna give you a side note on this too, but some salts have more minerals. So that's wonderful if you don't have kidney disease. But if you have kidney disease, salt is salt. And so or blood pressure problems, salt is salt. And so you're just going to need to limit that period. Because I get that all the time. Well, I'm eating pink Himalayan salt. Okay, it's still salt. It may be, if you didn't have kidney disease or blood pressure problems, a little bit maybe a little better than other things, but no, it's still an issue. Now, one thing I will say about salt and minerals, if you are like with people who are severely limiting salt, so those with kidney damage, you may want to supplement with a little bit of iodine. And you can just get it in drops and you don't have to be, it doesn't have to be some, oh, I've got to know exactly how much, just whatever the serving size is on the drop, just put a little bit in some water or something. And then that you'll at least get the iodine, but no, salt is salt. It will raise blood pressure.
Okay, thank you. And so, keeping that in mind, what about the idea of seaweed and taking seaweed for iodine? Would that come with salt also?
Hmm.
So we should minimize that, or is that okay?
Yeah, I don't love seaweed, so I haven't looked at that label to know, but you can I think there's different supplements and things, seaweed supplements that you could do. And yeah, you will get iodine from that. Just make sure if you're doing something like that, just know how to read labels. See if there's sodium in it, and if there is, then find something different.
Great, thank you. Um, and how does your approach to treating kidney disorders differ from the mainstream conventional medical wisdom?
Um okay, real mainstream wisdom is there was this trial, unfortunately, called the MDRD trial. And that trial, initially, they said it shows, they looked at lowering protein intake as a portion of that trial. It was a big trial, but as a portion, they looked at that and they said, you know what? This trial showed that didn't do anything. Well, the trial it was just a sloppy trial, first of all. And then, second of all, it when they did a secondary analysis, they noticed, you know what? Wow, no, it actually does help kidney disease. But the problem with that trial is that it set up what happens now in mainstream medicine. And so doctors say there's nothing you can do. They don't even think to refer to a dietitian. They're going to put you on different medications depending on your cause of kidney disease, and then they're going to say, come back and see me in 3 months or 6 months, depending on what stage of kidney disease you're in. And they're just going to keep watching until you fall forward to dialysis. Whereas when people come to me, um, and this is where, so I'll tell you, I'm even a little bit different than some of my dietitian colleagues. And there, let me tell you, there's not a whole lot of pre-dialysis kidney dietitians, but there's some awesome ones. Some of my colleagues on Instagram, I even follow them. I'm like, I'm so glad I have other people side by side working with me in this. But if you come to me, some of them will say, oh, you can kind of eat whatever you want. I'm not that person. Here's what I am. Uh, um, I am relentless to keep you out of that dialysis chair. And I tell people that, and I'm going to set the bar up here. Okay. And, and because if I set it up here and you say, okay, and then I'm going to say, now, what are you willing to do? I'm going to tell you the truth. I'm going to set the bar high. Now, what are you willing to do? And if you say, well, I can do everything but X. Okay. So then if I set the bar here, then you came here. But if I go, oh, you can just eat whatever, then it gets too free and your kidneys continue to decline. And so I'm definitely different from mainstream medicine that tells you there's nothing you can do, but also I'm going to be pretty hardcore in keeping you on as close to a complete plant-based diet as you're willing to do, boosting up nutrients, and really fighting after getting that GFR back where it goes. And then you know what? When it gets there and you write me and you say, Jennifer, I got my labs and my GFR increased by 10 points, then we're going to celebrate, because there's nothing that makes me happier than that, to see people get better. People get better. And if you're a stage 4 or 5, sometimes you don't. Sometimes at that point, the kidneys are so damaged that maybe we don't get better. But you know what we may do? Hold steady. Because if you're holding steady, then you're still not sitting in that dialysis chair. And so we hold steady and we maybe start hoping for a transplant or something like that. So that's what makes me different.
Of the people who do get better, because it's very common, like people will get better and they're like, well, I'm cured, right? And then they say, no, I can do whatever I want. What is the recidivism rate, if you will, for people who get better falling off the wagon, or the people who get better and staying? What's your experience?
Hmm. Hmm. Most of them stay if they truly understand what they're fighting against. Most of them say. Now, I will say this: people do fall off the wagon, and they'll message me and they'll be like, "I just got my GFR back and dropped 15," and I'm like, "Oh my god, okay, we need an appointment. Let's get back together, get back on the wagon." And then they get back on the wagon and it goes back up. So, but just know, when every time you fall off the wagon, anytime your blood pressure's high, or you're not doing what you should be doing, you're killing nephrons. You only have so many nephrons in that kidney. And when they're gone, they're gone. They never regenerate. And so that's what I tell them. Like, this is something you have to do forever. And guess what? And this is something else I want people to know. Sometimes, and I know this firsthand, okay, I live in Mississippi. It is the most unhealthy state in the entire nation. I grew up in the Mississippi Delta, which is the most unhealthy part of the most unhealthy state in the entire nation. So down here, you can kind of feel like the Lone Ranger when you eat healthy. But I've gotten to a point, I don't really care, because I'm not going to sacrifice my health and my body to make someone else feel comfortable or to fit in with the crowd. And so sometimes you may be out there kind of feeling like the Lone Ranger. But what I want you to know is you're not alone. There are people all over the United States doing what you're doing. One, and then two, you got me. If you just need, sometimes if you just need, you're just discouraged, message me. But also, everybody should be eating this way. People should not be eating the standard American diet. So you're actually doing what's right and what other people should be doing. Um, but sometimes you just feel like you're the odd one out. And I think that makes it hard.
Yeah, I know that feeling. So, what messages do you find most resonate with your patients in order to get them to move forward with making healthier choices?
Um, I mean, I guess they could tell you that, but here's what would resonate with me. Um, if they understand what dialysis is. Once you hit the dialysis chair, prognosis is 5 years. Now you can live longer than that. I mean, I've had people on dialysis. I worked in dialysis for 20 something years. People can live for 20 years on dialysis. But it's not an easy life. And so if you're doing in-center hemodialysis, what you need to know is that you're going to that center 3 times a week and you're going to sit in that chair for 3 to 5 hours. Your arm is attached to the machine. You can't move this arm around because it's attached to the machine. So you're sitting very still. So I say this, imagine you went on a 5 hour road trip and you never stopped for a break. You just sat in the car 5 hours, no break. And one of your arms you can't move. That is in-center hemodialysis. I never recommend in-center hemodialysis. I recommend people do home dialysis, but even home dialysis, your lifestyle has changed. I mean, you have a whole other thing you have to manage now. And think about the amount of life you lose, the time you're spending in a doctor's office, which is a lot. Ask any kidney failure patient how much time they spend in doctor's offices. Let's take, for example, you're a hemodialysis patient and the weather's bad, like what it is here today, and the power goes out and your second shift. Well, first shift did not get to run their 3 to 5 hours on time because the power went out. So now you show up at the clinic and they're like, I'm sorry, it's going to be 2 hours because we're still running first shift. So now your 3 to 5 hours just went to 7 hours. Those types of things, people don't think about how much it disrupts their life, but it does. So let's don't go there. And here's the other thing. Once you get on dialysis, you're going to have to be on a special diet. Why not just eat a healthier diet now without dialysis? Because either way, you're going to have to change your diet. So,
So with people, and you may have said something about this, I'm not sure. Do with this protocol, can people go off of dialysis once they're on dialysis?
no, not for any extended period of time. Let's say, well, here's the thing: kidneys don't regenerate. They just don't. So once they're gone, they're gone. You can come off with a transplant, but transplant's not a cure. People think transplant's a cure. It's a treatment. You're on medicine the rest of your life, and that transplant is not going to last forever. But if you wanted to come off of dialysis, basically what you're saying is, I'm going to just go with this until I die. And it depends too. So like there can be someone on dialysis and their GFR, that's the tells how much your kidneys are functioning. Let's say they have a GFR of 7 on dialysis. They could come off and eat that very low protein keto analog diet and they might live, a year, 2 years, something like that. I can't predict exactly, nobody can. But eventually they would succumb to kidney disease.